first reports of ongoing trials, and as such, the success rates will vary. However, there is one radical new therapy that has proved consistently effective over sustained clinical trials, and it's based on a particularly insidious pathogen that has inspired dread for more than 30 years. Perhaps the most terrifying virus of the modern era has been HIV, the virus that causes AIDS. If, like me, you grew up in the 1980s, it was difficult not to be affected by the pandemic that this virus caused. So much was unclear about this disease, from its origins to its effects, and even its detection and treatment. For a long time, AIDS was synonymous with fear, which is precisely the reason why the news that this deadly virus is offering perhaps the best chance of all in finding a cure was so surprising. Here at the Children's Hospital of Philadelphia, doctors are using HIV to treat leukemia.
She was diagnosed just after her 5th birthday. They kept saying that she seemed a little more sick than most kids are and nauseous all the time.
For 5-year-old Emily Whitehead, acute lymphoblastic leukemia proved to be unexpectedly aggressive. In 2012, after 2 years of chemotherapy, she relapsed for the second time.
She went from 85 to 90% chance, to less than 30% chance of survival.
It seemed that there was nothing that could help Emily.
So the doctor told us that we were pretty much at the end and talked to us about taking her home. And we weren't ready to give up at that point.
Sure.
And so we called Children's Hospital of Philadelphia just to say, do you have any type of a clinical trial? We're at the end and we need something. And they said, well, actually, T-cell therapy has just opened and we're accepting our first patient.
T-cell therapy is the brainchild of Dr. Carl June, whose background in studying both cancer and HIV, the virus that causes AIDS, gave him a new perspective to an old problem.
All the standard people trained in oncology went in with other oncologists, and they didn't know about the potential, really, of HIV to apply that to cancer.
Now, the key to this concept is the manipulation of the patient's own T cells, the very foundation of the human immune system. They're white blood cells that circulate throughout our bodies, seeking out and destroying foreign pathogens.
So what we learned was how to use HIV to reprogram that T cell so that then it can easily tell if it's a leukemia cell or a normal cell. We have in planes IFF, identification friend or foe.
Sure.
And we use that in the military to know when you see, do you shoot or not?
Yeah.
Is it one of your own? This is IFF for the T cell. The T cell wakes up and it says that's foe, and it says kill it.
Now, Emily's parents were utterly desperate, but the idea of a treatment based on HIV was still troubling to them.
We were overwhelmed with fear. Anyway, before we heard any of that, the doctors said, I can't tell you that this treatment will take Emily's cancer away, but I can tell you that she can't get HIV from this treatment.
Right.
There are a number of labs over 15 years learned how to, if you will, gut HIV. And then what's left behind is a machinery so that it can infect a cell, but only once. And when it does that, it doesn't cause disease, but it inserts the reprogramming element that we want.
Although Emily was the first pediatric case to receive the treatment, 3 adults had already undergone T-cell therapy. In all of those cases, it was found that once the T-cell began to attack the cancer, that the patient's physical reaction was extreme.
The first patient was treated in July of 2010, and he became very ill after we treated the patient, and to one point where last rites were given, and 2 or 3 days after we treated him, he had a 104-degree fever, and that lasted for about 3 weeks.
And it turns out that with Emily's treatment, the reaction was even worse.
The same thing happened as it happened in adults, but it was actually more vigorous and more violent. She went to 106-degree fevers. It was really touch and go.
She spent 14 days in a coma.
Right.
Because it had overwhelmed her system.
Sure.
It's absolutely brutal to watch. The doctors said, call your family in because there's a 1 in 1,000 chance she's going to be here in the morning. Emily just kept fighting. She, woke up on her 7th birthday when she was coming out of it.
Thankfully, Emily survived the infusion. But because she was the first pediatric patient, nobody actually knew if the therapy itself would be successful. But Dr. June hoped that her type of pediatric cancer was similar enough to get the same incredible results that they had seen in the first adult patients.
28 days after we treated him, they finally did a bone marrow examination, because bone marrow is where the tumor is in leukemia. And it came back, there wasn't any. We all thought that was a great result, but I was really incredulous. I said, like, this can't be right. You know, can you do it again and look on the other side? And so they looked at the other hip, and the same thing came back on day 31. There was no leukemia.
April 17th, 18th, and 19th is when they put the cells in. May 10th is when I got the call from Dr. Grutt. Can't find a cancer cell.
They gave it to her, and 4 weeks later, she was in remission.
What do we tell them about the T cells?
That they went to boot camp.
They went to your T cells went to boot camp. And what did they learn at boot camp?
How to kill cancer.
They're like, you know, getting dogs ready to go eat that cancer. Emily was the 4th patient in the trial, and all 4 patients went into remission within 4 weeks.
We had seen an unprecedented thing where pounds of leukemia literally went away in a few weeks.
When you say pounds of leukemia, you mean someone loses 5 pounds, let's say, and that's leukemia that they're losing.
Yeah. We did calculations on our patients, and they have between 3 and 7.5 pounds of tumor when we treated them. And so that's the power of this approach.
Amazing.
Is that better? All right. How you feel?
Good.
You go to school
Yeah.
every day?
Yeah.
Never miss?
Just to come down?
That's what it's my fault. Anything bothering you?
No.
Now, if you didn't know that she was sick, you can't tell
You
by
would
what
never
you
know. She's just a normal, healthy.
So we've had full remission.
Absolutely.
Yes.
Yeah.
How does that make you feel as a doctor when you come up with this thing and say, well, we've tested it, we've tried it, and then you see a young girl who was dying. She was done, and now she's cancer-free. I mean, that must be the greatest
an
feeling.
incredible feeling.
Yeah.
The reward of seeing that, of both in the parents and the children, is you can't describe it.
Now, one thing that Dr. June hadn't expected was that despite astonishing results in his early patients, that no one would fund the rest of his trial.
The reason our philanthropic funding dried up was we had the 2008-9 Wall Street collapse.
Right.
And therefore, a lot of the money that went to the Leukemia and Lymphoma Society and so on, that was just dried up.
Yeah.
And we couldn't get money from the government, and even to this day, we're under sequestration.
In desperation, Dr. June took an unorthodox step.
Normally, you can't publish your results when you have 1, 2, or 3 patients.
Right. In the hope of spurring interest in the research, he released his groundbreaking results.
The first patient was on the front page of the New York Times.
Right.
And our lives completely changed that day.
When we read this and we heard about Emily doing so well, and it was just so hopeful to think there was another way to go about battling this without putting your kids through such torture.
Troy Lee was diagnosed with leukemia at the age of 5. She underwent 4 years of chemo and radiation before becoming the 10th patient in the trial.
Within a month, I'd say, she was back in school.
Wow. How long have you been in remission now?
A year?
A year and 9 months, right?
Nearly 2 years.
Yeah.
She's able to play with her friends and have sleepovers like a normal 11-year-old girl does.
Watching her for so many years struggle is agonizing for a parent, and
Sure.
looking at her now, it's really incredible.
So how you feeling?
Good.
Any problems?
No.
Not been in the hospital for any reason?
No.
You're just perfect in every way?
No.
No? Okay. So no complaints though?
But here's the real headline. 39 children have since been treated with Dr. June's T-cell therapy, and an astonishing 90% of them have experienced complete remission.
And nothing hurt? Certainly speaking for myself, and I've been at this for a while, I've never seen anything like this in my life.
These patients, when they enter remission, most stay in remission for several years. There has been no therapy that does that.
Now, while I was interviewing Dr. June, I realized that we were no longer talking about treatment, but that we were actually talking about a cure, which in my mind immediately raised 2 questions. So everybody watching this is going to be saying, oh my God, okay, how does this get out from UPenn to the rest of the world?
It's probably going to be out, FDA approved and available throughout the United States in 2016.
And my second question was, will this work for other cancers? What about other kinds of cancers? I know it's early days, but theoretically, what are we looking at?
There are about 300 kinds of cancer, and there are about 5 kinds at least of leukemia, and so many of those I think are going to be cured.
And that's why all these doctors are so excited.
I think you're going to see people having great responses where they leave the clinic and their cancer is gone. And I think that is happening already, and we're going to see more of that.
We know we're on the right path, and it's really energizing to keep us pushing in that direction.
So this is probably the biggest news in cancer since chemo and radiation.
This is one of those things that is a true paradigm shift, in this case for cancer.
You're taking things that used to kill us to actually go and kill the cancer.
Yep.
Now, if these response rates can be held to a wider population, and viruses can be engineered to attack other cancers, then we have truly reached, in Dr. June's words, a paradigm shift in treating cancer. And for all the Emily Whiteheads out there, this is certainly fantastic news.
So I hear you like basketball. Who's your team? You like the 76ers or?
Penn State.
Penn State. Yeah. Oh, college. Are you going to go to Penn State for college?
Yes.
Do you have anything you want to say to anybody out there who's fighting cancer?
Keep fighting and believe in yourself.
Okay.